The instrument used to measure the blood pressure is a sphygmomanometer. This is an important tool in the tool pre-hospital emergency care and also in several areas of health. There's a pump that during its compression to tight the cuff around the arm, through a mechanism of compressed air. During this compression, there is a dial that allows us to see the pressure imposed to the brachial artery. The cuff can be used on both sides. On the right side, on the reverse side. The cuff can be used only once of each arm, but your arm will give false measure because it's all just being compressed. Paramedic can perceive systole and diastole pressure on dial. The dial gives us only the measurement of pressure and is to paramedic to take the measure he intended by the pulse with stethoscope. The first bang is a systole and the last bang is a diastole. After you compare the result with a normal blood pressure, 120 on 80 mm of mercury.
To get the precise result while taking blood pressure, you are choosing the right side of sphygmomanometer because it's different for children and for fat person. First, I need to be sitting or lying down comfortably and relaxed. For an optimal result, my arm should be free of all clothing, so my shirt needs to be removed or my sleeve must be pushed up. There is an arrow on the airbag of the sphygmomanometer and the paramedics need to set it up so it is centered over the brachial artery. So, they feel the skin around the elbow area. Then, to hear the heartbeat, they are using a stethoscope, which is an acoustic musical device for auscultations. They place the round metallic side of this device on the located artery.
Now that the sphygmomanometer and the stethoscope are installed, I have to be sure that the valve is closed to start to pump the cuff. Now I start to pump and I stop approximately to 160 or 180 mm of mercury. Okay, now I have to stop. After, I have to open the valve very slowly to let the air comes out. Now, when I hear the first pulse, it will give me I have to take the measure on the dial and it will give me the systolic pressure. And after, when the pulse stops, I have to take again the measure on the dial and it will give me the diastolic pressure. And for example, it can be 110 on 76 mm of mercury. And after, I only have to compare with a normal pressure.
It's important to know the blood pressure because there's a lot of diseases related to. There are two major diseases. It can be high blood pressure, we call hypertension. High blood pressure makes your heart work harder over time and damages your blood vessels throughout your body. If the blood vessels in your kidneys are damaged, they may stop removing waste and extra fluid from your body. Fluid from your blood vessels may then raise your blood pressure even more. It's a dangerous cycle. There is another disease we call hypotension. This is when your blood pressure is low. When the flow of blood is too low to deliver enough oxygen to the vital organs like the brain, the heart, and the kidneys, the organs don't function normally and may be permanently damaged. So the blood pressure is a vital thing that the paramedics have to take to know if the patient is in a good health.